So what are the contraindications to lumbar puncture? The only absolute contraindication according to me is going to be coagulopathy only, very commonly asked question in exam. So coagulopathy. So either the patient is currently using anticoagulants, or if the platelet count is less than 50,000, so then the risk of hematoma is going to be very high. So these are going to be definite contraindications for lumbar puncture. Number one, always coagulopathy. So in patients who are having evidence of raised ICP, and if that is because of mass lesion, there is a risk of tonsillar herniation. So that is also going to be a contraindication for lumbar puncture. Any raised ICP feature with mass lesion in the brain, you cannot poke on the spine because it's going to result in herniation, because water is going to move from a region of higher pressure to region of lower pressure. Now, when you open up, your atmospheric air is communicating with the CSF. Now, atmosphere becomes the area of lower pressure. So, in the name of coming, like pushing the pressure from the brain into the spinal cord, it's going to push the tonsils, and tonsils are going to compress the spinal cord and the medulla. It's going to result in paralysis and respiratory failure, and patients will die. Okay, so there is a risk of spinal hematoma in the setting of lumbar puncture. So you have to look for the delayed motor sensory or sphincter disturbance in this case. So presentation of spinal hematoma is going to be in the form of a painless progressive deficit. So it's going to be painless and progressive deficit. Okay, deficit in the sense we're talking about neurological deficit. That's how spinal hematoma is going to present. Anyway, it's going to be similar to our spinal epidural abscess and other abscess that we'll be discussing later on, but it's going to closely mimic a spinal epidural abscess. We'll talk about that in a while. But don't forget coagulopathy and absolute contraindication for doing a lumbar puncture. And some textbooks say infection over the site. Who's going to do that? If there is an infection over the site of poking on lumbar puncture, so who's going to do this? So that's a nonsensical contraindication, but still, if you want to remember, you can remember.